If you are an insurance-based therapist in private practice, this video is for you. Today, we are going to talk about some really important Medicare and insurance billing updates for 2025 that you need to know. These changes could impact your practice, and I want to make sure you're prepared so you can stay compliant and maximize your reimbursements. Before we dive in, I'm Kim Tolson, the founder of Bill Like a Boss. In Bill Like a Boss, we help you master insurance billing, maximize profits, and take control of your practice. Click the link down below the video to learn more about Bill Like a Boss. I'll also include the links that guided the content in this video. Here is what we're going to cover in this video. First, we will go over Medicare's confirmed telehealth policies and what is here to stay. Second, we will look at temporary policies that are set to expire in 2025 and what you should be planning for now. Third, we will break down the in-person visit requirement because there is still a lot of confusion about whether it is coming back. And finally, I am going to share some suggestions about how to navigate around the in-person requirement if it's not possible for your client to come to the session in person. By the end of this video, you will have a clear understanding of what is changing and what steps you need to take to keep your practice running smoothly. Let's get started. The good news is that some big telehealth wins for mental health professionals are now permanent. Medicare will no longer have geographic restrictions for mental health telehealth services. That means your Medicare clients can receive services from home no matter where they live. Before, telehealth was mostly limited to rural areas, but that is no longer the case. Federally qualified health centers and rural health clinics can now permanently provide behavioral health services through telehealth. This is a major step in expanding access to care, especially for underserved communities. Medicare will also continue to reimburse for audio-only therapy sessions, which is great for clients who may not have access to reliable internet or video capabilities. Just make sure you're using the correct billing modifier, like Modifier 93 for audio-only communication. And one of the biggest wins is that telehealth visits will continue to be reimbursed at the same rate as in-person visits. That means if you're providing therapy through video or phone, you will still get paid the same as if the session were face-to-face. Now let's talk about what is only temporary and set to expire in 2025. There are still a few policies that will only be in place for a little while longer. Right now, Medicare is still allowing telehealth for non-mental health services, but that is set to expire on March 31st, 2025. After that, those services may go back to pre-pandemic rules, which could mean fewer telehealth options for certain medical specialties. One more thing to keep in mind is that many providers have been using their home address as their practice location when billing Medicare. That flexibility is going away at the end of 2025, so if you are using your home address, you will need to update your practice location before that deadline. Now let's get into one of the most confusing parts of Medicare's telehealth policies, the in-person visit requirement and its exceptions. Medicare still technically has a rule that says clients must have an in-person visit within 6 months of starting telehealth services, and then an annual in-person visit after that to continue receiving telehealth care. The reason this is so confusing is because the rule keeps getting delayed. It was originally part of the 2023 Medicare physician fee schedule final rule, but it has been postponed multiple times. Right now, it is set to go into effect on April 1st, 2025, but there is a chance that could change again. Congress is still debating whether to remove this requirement altogether, but as of now, it is still in place for next year unless another delay or policy change happens. You might be wondering, what if my client can't come to my office? Maybe they have transportation issues, or they live on the other side of the state, or they can't leave their home. There are some exceptions, but they depend on whether the client is new or established. If a patient began receiving mental health telehealth services during the public health emergency or the temporary waivers afterward, they do not need an in-person visit within 6 months of March 31st, 2025. Instead, they will be considered established clients and will only need an in-person visit once every 12 months. For new clients, however, there is no exception to the 6-month in-person visit rule. Any new patient starting telehealth services after March 31st, 2025 must have an in-person visit before they begin telehealth treatment. In some cases, Medicare will allow an established or new client to skip the required in-person visit every 12 months if there is a valid reason. Here's what that means. If the client and provider agree that an in-person visit would create more harm than benefit, the visit can be skipped for that year. This could apply in cases where an in-person visit would disrupt care or cause unnecessary distress. The client is clinically stable and only needs maintenance care. The client lives far away and travel would be a hardship. The client may disengage from care if forced to come in person. The practitioner must document the reason in the client's medical record. The annual in-person visit can be completed with the treating provider or another provider in the same practice and subspecialty. Medicare providers are encouraged to develop clear record-keeping procedures in case of an audit. If you decide not to require an annual in-person visit, your documentation should clearly state why, such as if the client lives out of town or if travel would create an undue hardship. You should also check with your local Medicare administrative contractor for specific documentation requirements. To wrap this up, here's what you need to do. First, know what telehealth flexibilities are staying. Medicare will continue to cover telehealth for behavioral health, including audio-only sessions, and telehealth will still be reimbursed at the same rate as in-person visits. Second, prepare for the expiration of temporary policies. Third, understand the in-person visit requirement and how it applies to your clients. While the requirement will return if the waiver expires, there are exceptions, particularly for established telehealth clients and annual visits where an in-person session may create undue hardship. And finally, make sure your documentation is solid. If you need to bypass the annual in-person visit requirement, ensure that your clinical reasoning is well documented. That's it for today's update. If you found this helpful, be sure to subscribe so you don't miss future Medicare and insurance billing updates. Thanks for watching, and I will see you in the next video.